Okay, today we're going to be demoing how to do the amalgam procedure, the amalgam steps that you guys will have a comp on. Okay, first you're going to start off by handing the dentist across in the transfer zone, which is right across the chest. We're going to give both the mouth mirror and the explorer. Okay, the dentist will look inside. We're working on the mandibular first molar. Okay. All right. The next thing that we would normally do after that is we would apply the topical, which we're not going to do this semester. Okay. Then the dentist would administer the anesthetic, okay, with the syringe. Okay. After that takes effect, then we will start the procedure. The dentist will go ahead and open up the tooth. So go ahead and use your handpiece. The assistant, the assistant, okay, grab it with pinky, okay, put it back here. Then the assistant is going to suction and use the air-water syringe to keep the mouth mirror open for the dentist, making sure to stay out of the way of the dentist. Okay. Once it's open, okay, go ahead. The dentist will move out of the way, and the assistant will come in here and rinse out the prep. Okay, removing that smear layer, debris. Okay, once that's all done, the dentist will indicate to go ahead and use our calcium hydroxide, okay, our Di-Cal. We have our small pad, our calcium hydroxide instrument with ball-ended point. Okay, you only would use a very small amount. Okay, squeeze out some. Remember to wipe the tip, because that's in your comp. You don't need very much, okay? And you're going to mix. Of course, you would mix right over here, off to the side, but for demoing purposes, you use a ball-ended instrument to mix, okay? You get a uniform color, a homogeneous mix. Okay. You make sure that you wipe the calcium hydroxide instrument before you give it to the dentist. Hand the instrument to the dentist. You bring the pad over in the transfer zone near the chin, right over the chest. You have gauze to wipe. Okay. And notice that I'm right here in the field for the dentist. The dentist doesn't have to go very far. Okay, if they're finished, you take the instrument and the pad and all with it. The next step is, while that is drying up, the assistant is prepping the varnish. Okay, is prepping the varnish with two separate microtip applicators, two different colors, okay, to indicate which one you've already used. Okay, you dip it in, take it out, hand it to the dentist. You also are going to be giving them the air-water syringe so they can air dry it. Okay, hand it to you this way. I'll get the other one ready because they're air drying it. Okay, hand it to the dentist. They do that. They do the final air dry. While they're doing the final air dry, okay, you are going to go ahead and mix the amalgam. In the meantime, I have my amalgam well ready. Have my amalgam well ready. If the pistil comes out in the amalgam, okay, in the amalgam well, excuse me, use the cotton tip applicators to remove it. Do not use your hands. You seal it right away. Use your amalgam carrier, and since my dentist didn't ask me what side, I'm going to load both of them. Okay. Okay. Make sure that when you hand the carrier that there are no flakes around here so that it doesn't fall on the patient. You hand it the amalgam carrier in the orientation that you're working on. So we're working on a mandibular molar. So I'll be handing it to the dentist with it facing down already. Okay? As the dentist is preparing that and putting it in, I will then already have my condenser ready, or my plugger. Retrieve, wait, give it to me from the back end a little. There you go. The dentist will leave me room from the back so I can come from behind, grab, and place. And we'll be transferring here in this zone. I'll come back. I'll start loading. Okay, I'll hand it again, transfer, bring it down, give it to my dentist in the correct orientation. Okay. Okay, there you go. Since we've finished with that, the next part, the instrument I will give her is the burnisher, so she can make sure to polish it up, push it down. Okay, she does that. Okay, next is going to be the carvers. Gave her the cleoid discoid. And while she's doing carving, what I'm going to do, the assistant's going to do, is have the articulating paper ready with the bar facing towards the cheek, because if we do it the other way, we'll be repairing that tooth again. In the meantime, I'm also suctioning up anything the dentist is carving. Okay? Alright? Okay, I hand this to the dentist. Okay? Okay. Tap, 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 patient bites down, taps, tap, tap, grinds. They want to find that high spot. Take this back, give the carver back to the dentist, come back in here and suction. Okay? Give it back to the dentist again. If the dentist goes, oh, it's good, then the next thing that I would give the dentist is going to be the burnisher. Okay? Okay. After that, I'll give the dentist back the Explorer to do any final checking they need to do. Then the dentist will go ahead and retrieve, take out the mouth mirror and the Explorer while we go in there and rinse. We'll go in there and rinse that and do a full mouth rinse. Okay? Then after that, what we do as assistants is we're going to make sure the patient's cleaned up, okay, and give them post-operatory instructions, which is going to be, you're going to be very careful for the next couple of hours because you're still going to be numb. You want to be careful not to bite your cheek or your tongue. Also, if you find a high spot, if you feel that your bite is off, then make sure to call us right away so that we can get you back into the office and adjust it. Because what you don't want to do is have a patient go away with a bite that is off. Okay? Thank you.
This one?
Oh, that's true. The last thing we're going to do after that, thank you very much, is we're going to move that cup for me. Okay? We would take the bib and we would curl it up so that no pieces of the amalgam fall off, okay? And we would place it on over the tray, okay? Now that's the end of the competency.